All right, let's dive into something I have to admit I didn't know much about before
Mm.
really digging into the research for this one.
Yeah,
Hereditary hemochromatosis.
right.
We've got some excerpts from a medical textbook for this one
Okay,
and a really interesting Q&A with a physician.
cool.
And I'm telling you, this condition is way more common than you might think.
It really is.
So if you've got anyone in your family that's ever been diagnosed with this, or you just want to understand this genetic disorder a little better,
Mm-hmm.
this deep dive is for you.
Absolutely. And it can be pretty sneaky how it affects you too.
That's what I thought was so interesting.
Yeah.
So let's start with the basics.
Okay.
Can you give us a clear picture of what hereditary hemochromatosis, or HH, actually is?
Sure. So at its core, HH is a condition where your body has trouble regulating iron absorption.
Okay.
It ends up absorbing way too much iron from your diet,
Mm.
and that excess iron starts to build up in different organs. The liver is usually hit the hardest, but it can also affect the heart, the pancreas,
Wow.
and even the pituitary gland.
So what are the consequences of this iron buildup?
Right.
Why is it such a big deal?
Well, just imagine iron like slowly accumulating in these really vital organs,
Mm-hmm.
and over time, it can lead to damage and dysfunction.
Oh, wow.
You can kind of think of it like rust
Wow.
slowly corroding the parts of a machine,
Oh, I see.
and that's why it's so important to catch it early.
Okay, I'm starting to see the issue here.
Yeah.
But how does this even happen? Is this something you're born with?
You hit the nail on the head.
Okay.
HH is primarily caused by mutations in a specific gene called the HFE gene,
Hmm.
located on chromosome 6.
Okay.
And this gene is responsible for controlling iron absorption.
Gotcha.
And if it's not working correctly, it can lead to that iron overload we were just talking about.
So it's genetic.
Right.
Does that mean if someone in my family has HH, I'm automatically at risk too?
It's not quite that simple. HH is inherited in what's called an autosomal recessive pattern.
Hmm.
What this means is to actually develop the condition.
Okay.
You need to inherit a copy of the mutated HFE gene from both your mother and your father.
So you could inherit one copy and be a carrier, but not actually have the condition yourself.
That's exactly right.
Wow.
And to make things even more complex, there's something called variable penetrance.
Oh, boy.
Essentially, what this means is that even if you inherit both mutated genes, you might not actually experience any symptoms or any health problems.
That sounds incredibly tricky to diagnose then.
Yeah.
If someone can have the genes but no symptoms, how would you even know to look for it?
You've touched on a really crucial point here.
Hmm.
This is why screening is so vital, especially if you have a family history of HH.
Okay.
There are some pretty simple blood tests that can check your iron levels, like the ferritin level and transferrin saturation tests.
Mm-hmm.
If those are high, it raises a red flag.
Yeah.
And genetic testing can then confirm whether you have the mutated HFE gene.
So it's almost like a detective novel, right?
Right.
Piecing together clues to get the full picture.
Right.
You might have a family history clue,
Right.
then the blood test clue, and finally the genetic testing clue.
That's a great analogy.
Uh-huh.
And just like in a good detective novel, sometimes those clues can be subtle
Yeah.
and easy to miss. So understanding the potential symptoms is so important.
Let's talk about those symptoms then.
Okay.
What should people be on the lookout for?
Well, as we've mentioned, HH can be sneaky.
Mm-hmm.
Some people experience no symptoms at all, particularly in those early stages.
Gotcha.
But when symptoms do appear, they can be quite diverse
Okay.
and mimic other conditions, which adds to that diagnostic challenge.
So what are some of the red flags then that someone might be dealing with HH?
One of the most common symptoms is fatigue.
Okay.
This can manifest as like general tiredness, weakness, lack of energy.
It's interesting how fatigue can be a symptom of so many different things.
Right?
It must be hard to pinpoint that to HH specifically.
It is. But along with fatigue joint pain,
Okay.
especially in the knuckles, is another telltale sign.
Interesting.
In fact, HH can cause a distinctive squaring of the knuckles
Mm.
that's visible on x-rays.
Wow, that's a very specific detail.
Yeah.
It's incredible how excess iron can manifest in so many different ways. What other symptoms might crop up?
Sexual dysfunction is another one
Uh.
that often surprises people.
Mm.
It's not always directly related to iron overload in the reproductive organs.
Oh.
The excess iron can actually impact the pituitary gland in the brain,
Okay.
which plays a crucial role in regulating hormones.
Ah, so the iron is indirectly affecting hormone production,
Right.
which can then lead to those issues.
It's fascinating how interconnected everything is in the body.
Absolutely. And it's a good reminder that seemingly isolated symptoms can sometimes have a more systemic root cause.
We've covered fatigue, joint pain, and sexual dysfunction. Are there any other common symptoms we should be aware of? Yeah. There are a few others that are less frequent, but still important to mention.
Okay.
For instance, some individuals with HH experience abdominal pain,
Hmm.
often localized to the upper right quadrant where the liver is.
That makes sense considering the liver bears the brunt of the iron overload.
Exactly. And speaking of the liver, it's worth noting that HH can increase the risk of liver cirrhosis,
Uh-huh.
a serious condition where healthy liver tissue is replaced by scar tissue.
Cirrhosis. That sounds pretty scary.
It is a serious condition,
Yeah.
but thankfully, if HH is caught early and managed properly,
Right.
the risk of developing cirrhosis can be significantly reduced.
That's good to hear. Are there any other long-term consequences of untreated HH we should be aware of?
Yes, unfortunately. In addition to liver problems untreated, HH can also increase the risk of type 1 diabetes.
Mm-hmm.
You see, the pancreas, which produces insulin,
Right.
is another organ susceptible to iron buildup.
So the excess iron disrupts insulin production,
Exactly.
leading to diabetes.
Mm.
It's amazing how widespread the effects of iron overload can be.
It really is. And if that wasn't enough,
Oh, God.
there's also a potential impact on the heart.
Hmm.
Untreated HH can lead to a condition called cardiomyopathy,
Okay.
which is essentially a weakening of the heart muscle.
Oh.
This can result in symptoms like shortness of breath, fatigue, and swelling in the legs and feet.
We've covered the liver, pancreas, and heart. Are there any other organs affected by iron overload?
Most of the damage occurs in those organs,
Okay.
but there's one more symptom worth mentioning, though it's less common.
Okay.
Some individuals with HH develop a bronzed or grayish discoloration of their skin.
Really?
This is caused by the deposition of iron in the skin cells combined with changes in melanin,
Okay.
the pigment that gives our skin its color.
Wow. So the excess iron can even change the appearance of your skin.
Yeah.
Okay. That's a lot to take in. It sounds like untreated HH can have some pretty serious consequences.
It can.
Let's shift gears a bit and talk about treatment.
Okay.
Is there anything that can be done to reverse the damage or at least prevent it from getting worse?
The good news is that with early diagnosis and proper management,
Okay.
the prognosis for individuals with HH is very good.
Oh.
While we can't reverse any existing damage, we can certainly prevent further harm and help people live long, healthy lives.
So what does that management look like?
Sure.
What are the go-to treatments for HH?
The cornerstone of HH treatment is a procedure called venesection.
Venesection.
It's a fancy term for a therapeutic phlebotomy,
Okay.
which is essentially just removing blood from the body.
So it's kind of like donating blood,
Mhm.
but with a specific medical purpose?
That's a good way to think about it. The goal is to reduce the amount of iron in the bloodstream.
That sounds pretty straightforward. How often does someone with HH need to undergo venesection?
The frequency depends on the individual and the severity of their iron overload.
Okay.
Initially, there's an intensive phase where venesection might be done weekly or even bi-weekly
Wow.
until iron levels drop to a safe range.
It sounds like that initial phase requires quite a commitment.
It does, but it's crucial to get those iron levels under control as
Right.
quickly as possible.
Right.
Once they're within a healthy range, the frequency of venesection is reduced,
Okay.
typically to a maintenance schedule of every few months or so.
So it becomes less frequent,
Right.
but still an ongoing part of managing the condition.
Exactly. It's a lifelong commitment,
Okay.
but it's manageable, and it allows individuals with HH to live normal, healthy lives.
Right.
Of course, alongside venesection, it's also essential to address any complications that may have arisen from HH,
Yeah.
such as liver problems, diabetes, or heart issues.
It's about taking a holistic approach,
Mm-hmm.
treating the whole person, not just the iron overload.
Precisely.
Right.
Now, in addition to medical interventions like venesection, there are also some lifestyle modifications that can play a supportive role in managing HH. Avoiding alcohol is a big one,
Okay.
especially for those with liver involvement. Alcohol can further damage the liver,
Right.
which is already dealing with excess iron.
That makes sense. Protect the liver as much as possible. So we've talked about avoiding alcohol. What about diet?
Okay.
Does what you eat play a role in managing HH?
That's a common question.
Yeah.
While dietary changes alone can't cure HH, there are some things to keep in mind.
Okay.
First and foremost, avoid iron supplements.
Right.
unless specifically prescribed by a doctor. It seems obvious, but it's worth emphasizing since many people take iron supplements
Right.
without realizing they could be harmful in this situation.
It's like adding fuel to the fire.
Yeah,
You already have too much iron, so no need to add more.
exactly. Now, regarding specific foods,
Okay.
it's not about eliminating entire food groups,
Okay.
but rather making mindful choices.
Right.
For example, red meat and shellfish are particularly high in a type of iron called heme iron,
Okay.
which is more easily absorbed by the body.
Gotcha.
Moderation is key here.
Mm-hmm.
You don't need to cut these foods out entirely,
Okay.
but just be mindful of your intake.
So balance and awareness are key. Are there any foods that are particularly helpful for managing HH? Like, do certain foods help block iron absorption?
While there's no magic food that can completely block iron absorption,
Okay.
some foods can slightly hinder it. For instance, foods rich in tannins like tea and coffee can bind to iron in the gut, making it less available for absorption.
So my daily cup of tea might be doing me a favor.
In a way, yes. But don't rely on tea alone to manage HH.
Why?
It's just one small piece of the puzzle.
Right. It's all about the bigger picture.
Right.
What about exercise? Does physical activity play a role in managing HH?
Exercise is always a good idea for overall health. While it doesn't directly affect iron levels,
Right.
staying active can help manage complications like diabetes and heart disease, which, as we discussed, can be associated with HH.
So it's another piece of the puzzle contributing to overall well-being. This has been incredibly informative. I have one more question before we wrap up this part of our deep dive. Since HH is genetic, what should people who have been diagnosed tell their family members?
That's a crucial point because HH is inherited. Your siblings, children,
Right.
and even extended family members could be at risk. Open communication about family health history is essential.
Right.
Encourage your relatives to talk to their doctors about HH and consider getting screened if there's a possibility of it running in the family.
It's all about raising awareness and empowering people to take charge of their health.
Absolutely. Knowledge is power,
Good.
especially when it comes to genetic conditions like HH.
Right.
The more people know, the better equipped they'll be to advocate for themselves and their loved ones.
This deep dive has been a real eye-opener for me, and I'm sure our listeners are feeling equally informed. We'll be back shortly to wrap things up and leave you with some final thoughts. We're back and ready to wrap up our deep dive on hereditary haemachromatosis, or HH.
Yeah.
I feel like we've learned so much about this condition,
Yeah.
from its genetics to its potential complications, and of course the importance of early diagnosis and treatment.
Absolutely.
But as we conclude, it's really important to emphasize that, so what's factor?
Right.
Why does all of this matter to our listeners?
Well, I think the biggest takeaway here is awareness.
Okay.
You know, HH often flies under the radar because it can be asymptomatic for so long.
Right.
So knowing your family history and getting screened if you're at risk is incredibly important.
Yeah. And you might be thinking, well, what if it's not me?
Right.
What if it's my brother or my cousin or someone else in my family?
Exactly.
That's why it's so important to talk about this condition with your family.
Yeah.
Share what you've learned and encourage your family to consider their own risk factors.
Absolutely. And if you are diagnosed with HH, remember, it's a manageable condition, especially when it's caught early.
Okay.
Regular venesection.
Right.
And a few lifestyle adjustments can go a long way in preventing further complications.
It's reassuring to know that even if you have this genetic predisposition, you can still live a normal, healthy life.
Exactly. And don't underestimate the power of knowledge. The more you understand about HH,
Right.
the better equipped you'll be to advocate for yourself
Right.
and make informed decisions about your health.
Yeah, don't be afraid to ask your doctor questions.
Right.
Seek out reputable sources of information
Exactly.
and connect with others who are navigating similar challenges.
Yeah, that's a great point.
You know, it's funny. We're constantly bombarded with messages about iron deficiency and the importance of getting enough iron.
Right.
But this deep dive has really shown us that too much iron can be just as problematic.
That's a great point. It really underscores the importance of balance in all things, including our iron levels.
So to wrap things up, if you've learned anything from this deep dive, let it be a call to action. Talk to your family about HH.
Yes.
Ask your doctor about screening.
Right.
And if you're already living with HH, know that you're not alone.
Yeah.
There are resources and support systems available to help you manage this condition
Absolutely.
and live a fulfilling life.
Well said.
This has been such a fascinating exploration of a condition that I think a lot of people, myself included, knew very little about.
Yeah.
And it's amazing how much we can all learn when we take the time to really dive deep.
It has been a pleasure diving deep with you. And to our listeners, keep those curious minds engaged.
Until next time, stay curious and keep learning.